Hello, everybody. Uh, my name is Sammy. I am a general physician here in Riyadh. Um, I founded a group called Voluntary Research, Voluntary Teaching Work Group. So, Voluntary Teaching Work Group. I was asked by students to do review for the SMLE or Saudi Medical Licensing Exam. I will do some questions and then close this video and then do another and close it and so forth. So we'll start here. These are questions that was from previous exams and was made by students at KSU, King Saud University. Okay, so this is a sample of questions of pediatrics. It asked Turner features, and there are no choices. Just says thick skin neck. So this is called a web neck, and you see it in Turner syndrome. And some more information about Turner syndrome is that it has 45XO mutation or gene, and it affects girls more than boys. It causes wide or the feature in the body include wide nipple space. So we can see a picture which will simplify things for us. So you can see this is the web neck. Okay, this is the general features, the short stature, the web neck or fold of the skin, and you will find the widely or widened space between the nipples. They're usually, as mentioned here, short. They have a feature called rudimentary ovaries or streaky ovaries. So they call it rudimentary ovaries, gonadal streaks, or sometimes they call it also streaky ovaries. And they would have like amenorrhea, so they have infertility because of these abnormality in their ovaries, and they would have, yes, as I said, amenorrhea, no menstruation. In the heart, they have constriction of the aorta, and they may have some deformities in the elbow. I think that's about it. or these are the common things you can find. They say, hey, there are some spots here, but it's not in all or like in it's not common, I think. Like this patient, they were presented with no spots, or the patients that I learned they had no spots, but you could take it as one of the features. Okay, so discolored spots in the skin. Child known case of diabetes type 1, lost consciousness at school. The last insulin injection is unknown. What would you do? Would you take him to the hospital? Would you give an IV ringer lactate? Would you give IM glucagon or insulin? You would give IM glucagon, or before even that, you would give like honey or anything sweet to help raise the blood glucose. And sometimes they use that first, the honey or the sweet material, and then if it doesn't improve, they use the glucagon as its severe one. Child with the history of repeated infections, failure to thrive, and anemia. His older brother also has the same condition. What is the most likely diagnosis? So there's anemia, there's failure to thrive, there's infections. Is it nutritional? Is it leukemia? Is it lymphoma? Is it chlamydopathy? It's a disorder in the hemoglobin, and they didn't mention the name here, but actually there's this syndrome known as here also they said it might be sickle cell. Sickle cell disease can actually cause repeated infections because the spleen is infarcted, or they call it asplenia. So the spleen is not working, so there would be infection with encapsulated organisms. And just to let you know, there are few numbers of encapsulated organisms. They even use a mnemonic for that. So here we go. So yes, some killers have pretty nice capsules, and these are the organisms here. So encapsulated organisms, these are the common organisms to infect people with asplenia. Okay, some killers have pretty nice capsules. S strep pneumonia, K stand for Klebsiella, H for Haemophilus influenza, P for Pseudomonas aeruginosa, N for Neisseria meningitidis, and C for Cryptococcus neoformans. So The strep pneumo would one of the problem that may cause is a pneumonia, can cause meningitis, Klebsiella, can cause also pneumonia, which is usually or often atypical. Haemophilus influenza is also a cause of meningitis, encephalitis, especially in kids, and it's HIB, Haemophilus influenza type B, but now it's reduced after giving them vaccines. Pseudomonas aeruginosa. Pseudomonas can cause lots of problems. One of them is you find it in burn patients. It can cause sepsis, wound infection, and I will also double check what else it can cause. Neisseria meningitidis is a cause of meningitis. It's called meningococcus, and it's given actually as a vaccine. There's a vaccine to prevent the infection of meningococcus that's given before or people older than 60 and before some situations like before going to Hajj in Mecca. So we see here Pseudomonas. So it's a frequent cause of nosocomial infections. Pseudomonal infections are complicated, life-threatening. Pseudomonal can be respiratory as pneumonia, bloodstream bacteremia, heart, endocarditis. This is the nosocomial, so there is like a specific population who get it, who are like admitted in the hospital. CNS, they get meningitis, brain abscess. Ear, otitis externa, and it's dangerous, this one. This is the one caused by Pseudomonas is actually dangerous. Otitis externa, Pseudomonas. So, it's called even malignant. So, malignant otitis externa. You see the severe swelling, pus coming, and here's an area of necrosis, if I'm not mistaken. Okay, so it can cause an eye infection, keratitis, endophthalmitis. This one is also dangerous. Bones and joints can cause osteomyelitis. The common cause of causing osteomyelitis is actually staph, right? Staph aureus. Okay, so staph aureus is a common cause of osteomyelitis. What else can cause osteomyelitis? There was this bacteria called Salmonella. It causes sickle cell. It causes osteomyelitis and sickle cell disease. So if you had a question on where they're describing sickle cell patient with osteomyelitis, you would think of Salmonella. Okay, after Staph aureus. GI tract can cause diarrhea. Pseudomonas causing uh, like enteritis. Uh, Urinary tract, but the most common cause of UTI is E. coli. There are some other bugs that can cause UTI. One of them is Proteus. Proteus actually causes, sorry. Yes. So Proteus here does cause something called staghorn calculi. Let's see an image of that so that it sticks in your mind. Proteus, staghorn calculi. So if you're presented with a question talking about Proteus, please think about, about staghorn calculi or very big ones. You think of Proteus. So here it's very big. This is another picture here. And usually these are actually ureas producing pathogens, so they produce ureas. And the questions to me would be, it would be presented as like there's a UTI and they did a full urine analysis and they found that it's urease positive. And you would think of one of them would be Proteus, Klebsiella, Staph, and Pseudomonas, which we're mentioning here. Okay? So, and it's skin. And you see, it's always the dangerous thing. This is ecthyma gangrenosum. Here is a picture of this ecthyma thing. Oh my god. So plaques and necrotic ulcers on the abdomen of a renal transplant patient. As you mentioned, it's common in nosocomial infections and immunocompromised as well. So that takes care of it. Here we go to the next question. Child was on clindamycin, developed abdominal pain, watery diarrhea. So what would you think of in a patient who has got abdominal pain, diarrhea after clinda? That's actually like a hint about C. diff, Clostridium difficile. This is one of the common organisms that you see in the hospital, and it's a dangerous one. It causes pseudomembranous colitis, and it can infect people, and like the method of protection after you see a patient with C. diff is by really washing your hands with soup and water. So if you just use the alcohol quick hand wash, then it's not going to be enough. You need to wash with water in order to kill this, or like in order to take it away from your skin. And what do you think is the treatment for C. diff? So it's caused by antibiotic, and then you give antibiotic. So you give oral metronidazole or oral vancomycin, because some do not respond to metronidazole, so you go one step further. So we will complete the next session.